Thank you, Mr. Chair, and welcome everyone. And thank you for that testimony from Hawaii Island. Um, our COVID response continues to perform extremely well, and I couldn't be prouder of our entire team. Our last numeric update was 85 cases across our 10 campuses, and that's since inception of the pandemic almost a year ago. I do think we have at least one additional case since then, but we update them when they are all confirmed. And while maintaining full vigilance against further incidents of COVID-19 on our campuses and in our community, we're now shifting our attention a little bit to the vaccination programs and planning for the fall. In the parlance of CDC and State of Hawaii prioritization, we are pretty well through Category 1A. Those are the frontline healthcare workers and those who are helping with vaccination efforts, and that includes many of our faculty, staff, and students on multiple islands. We are now starting into 1B. Those are other frontline essential workers, and we're fortunate that the State of Hawaii has included higher education along with K-12 education as frontline essential work. We are now focused on our employees who need to spend time on our campuses and are at the highest risk. This includes groups such as our custodians, who are working tirelessly to keep our facilities clean and safe, our faculty who are teaching courses in person that cannot be offered online. Those are the science labs, studios in the arts, clinical practices in the health sciences, shops in the technical fields in the community colleges, and other staff who must work on campus. We're continuing to work closely with the Department of Health to ensure that our priorities stay aligned with the state guidelines. We had a major 1B group startup effort on Oahu. It was unfortunately set back by the delays in shipping vaccines that you may have read about in the paper this morning that did impact us. That was due to the storms on the continent. But we have already helped to vaccinate over 1,500 of our UH Ohana on Oahu alone, and we currently plan to resume the major program next week. I want to thank a lot of entities that have made this possible. Leeward Community College and Maui College, which have hosted pods or points of dispensing, affectionately known as pods, for their communities, not just for us. To Community College Associate Vice President Mike Unabasami, Doctors Lee Boykanseo Lam of JABSOM and Chris Qureshi of Nursing and Dental Hygiene at UH Manoa. They have been actively engaged in supporting the Department of Health statewide in vaccination planning. And to Vice Presidents Okinaga and Yoshimi and their teams, and to Deb Ishii, all of whom have been really instrumental in coordination of our data collection for every one of our UH employees, and then rollout with our vaccination team under very uncertain circumstances that change literally day to day. So in planning for fall, we do expect a substantial return to in-person instruction, and that's why the vaccination program is so important. And that will take place along with a healthy mix of hybrid and online classes along with in-person. The assumptions that underlie our planning are fairly conservative, we think. First, based on all we know about vaccine availability, the capacity we have across the islands to deliver vaccinations, and the state prioritization of higher education as 1B or essential, we believe and we intend that all of our faculty and staff who are willing to be fully vaccinated, will be fully vaccinated before the beginning of the fall semester. We do not believe we can assume at this time that all of our students will be vaccinated by fall, including for those who may be arriving from other states and other countries. We therefore believe we will be operating under some significant restrictions, such as the requirement for everyone to be fully masked indoors, and at this time we are still assuming a 6-foot physical distancing requirement. This distancing requirement severely limits the capacity of our classrooms and will be driving a lot of our planning. And that's why we expect next fall to offer many more hybrid and high-flex courses in which some portions of instruction in classes will be in person and online for some or all students. We will, of course, continue to offer courses fully in person that cannot be readily offered online, as we have been throughout this year. And each campus is prioritizing courses for in-person offering that they believe necessary to maximize the success of their students. Vice President Young will provide a legislative update later in the agenda. So let me briefly share a federal update as well. As Senator Schatz, who's a member of the Senate Appropriations Committee, noted yesterday, work on the next stimulus bill is actively underway. The U.S. House of Representatives is now developing specific bills that implement the Biden stimulus plan across each sector. And while there is a very, very long way between a House bill in a committee and federal enactment, the current work hopefully gives a sense of where Congress may be headed. The House Education and Labor Committee has approved their reconciliation bill, which includes $40 billion for higher education and $130 billion for K-12 education. This is more than was provided through either the CARES or CRSA Relief Acts last year, and I comment on K-12 because that's the dominant part of the state general fund budget as well. So relief for K-12 helps the entire state of Hawaii. When I talked with the governor this week, he was also hopeful that the Biden plan, which does include substantial support for state and local government, would provide sufficient relief for him to back off many of the more severe cuts that he has recommended in his current version of the operating budget. Again, this is one-time funding only, and as the testifier noted earlier, this doesn't solve our structural problems at the state or at the university with current expenses that exceed the revenue we can expect through the years it will take for Hawaii's economy to fully recover. And nothing is certain. So these promising possibilities can't change the work we are doing. They cannot be a reason to try to believe we can return to business as usual. We fully intend to proceed with full urgency on the post-pandemic planning work that is underway across the system and that Regents have heard reflected in testimony in past meetings that has caused so much angst. Even with the one-time help from the federal government, if it occurs, and even if Hawaii's economic recovery were to accelerate, we cannot return to the way things were. The state of Hawaii needs much more from us than we were providing before this pandemic, and we need to learn to become more self-reliant to support the high priority programs that are essential to Hawaii's future. And much of this is laid out in the budget policy paper that was approved by the Board of Regents last year. Given what will always be constrained state revenues and many other pressing state needs, UH cannot keep going back to the legislature for every new program we want to add. We do need to depend on the state, and we should expect them to maintain a reasonable and predictable level of support for public higher education. This is a critical function of the state. It benefits the entire state, and it's essential to create a positive future for Hawaii, directly and indirectly. We particularly need continuing help to ensure high quality facilities across our campuses, and we need help with our fringe benefit costs, which are funded by the state largely and are 100% controlled by the state. But we need to do our part as well. We need to operate as efficiently and effectively as possible as a system to serve the entire state. We need to show a strong willingness to prune and grow ourselves to meet the most critical needs across our islands for recovery and sustainability in the future. And we need to use the flexibility we have to develop stronger revenues beyond relying on state support and tuition. So more to come on this as our post-pandemic work continues under full light of sunshine and day. So some highlights on some of the numbers that we watch. First, enrollment. Our spring census date was last Friday, so that's when we derive our official enrollment numbers. UH total headcount enrollment declined slightly, 0.9%. We're at just over 46,000 for spring, which is always lower than fall. Our headcount enrollment spring over spring increased at UH Manoa and Honolulu Community College, and held steady at Leeward. Headcount enrollment at the other 7 campuses declined. Classified student enrollment increased at UH Manoa, UH West Oahu, and Windward Community College, and was down at the remaining 7 campuses and for the UH system overall. Classified entering student enrollment increased a whopping 9% for the UH system. So those are students who are new and returning to UH. Increases occurred at most campuses, UH Manoa 16% and community colleges 8.9%, which is wonderful. Classified continuing student enrollment, those are those who continued from fall to spring, declined 2.4% compared to last year, with increases at UH Manoa and UH West Oahu. And our early admit, mostly early college students, are down 14.2%. We believe, again, this is in large measure due to challenges with online early college enrollment. While the decreases are regrettable, we can be really proud of the increases. And even in the areas where we have decreases, we continue to outperform the national averages as a whole, which are declines across the board at all kinds of institutions. Our research as of this morning is at, or our extramural funding, I should say, is over $325 million compared to February 18th last year. That's an increase of almost 18%, which is fabulous. Philanthropy performance is even higher relative to last year. We're now at $67 million year to date. That's compared to $37 million last year. So an 80% increase. Kudos to VP Tim Dolan and the whole UH Foundation team. Let me share 2 notable personnel changes. You have a very long list of salaries posted for information. Included in that list is just one new appointment, and so I want to highlight it because you wouldn't notice it otherwise. Next month we will be welcoming Michael Shibata to Vice President Young's shop. He will be leading our fledgling Office of Strategic Development and Partnerships, aka our Real Estate Modernization and Real Estate Management program. Michael comes to us from the Liliuokalani Trust, where he was Director of Real Estate. Before that, he worked at Stanford Car Development and at PBR Hawaiʻi Associates. And so he's got a balanced blend of experience working at an Ali'i Trust, managing their real estate assets, at a private development company, and as a land planning consulting. This was really a challenging and protracted recruitment that's been going on for some time. So congratulations to Calbert on finding a great candidate at last. We also bid aloha and mahalo to Kim Hashiro. She has led HR for us for the past several years. Kim is leaving us for a deputy director position in Mayor Belangiardi's administration. She leaves behind a legacy of transformed processes, improved customer service, and a vision for the office that we will continue to pursue. She's been a stalwart in many, many HR challenges and surprises that we faced over this past year due to COVID-19. And notably, she's been instrumental in a very significant upgrade to our PeopleSoft HR system that is planned for this weekend, our first major upgrade in many, many years. And we wish her, Kim, all the best at the city and county.